and to seek the treatment that is best for you. Our panelists are qualified professionals. However, they are not liable for their comments since they are not acting as your personal physicians or health advocates. So it is time that we as a patient community delve deeper into this conversation. I'm thrilled to have back with us our favorite board-certified rheumatologist. You know him as the master behind the best-selling Lupus Handbook, the Lupus Encyclopedia, which, by the way, has a brand new second edition coming out September 5th, Dr. Don Thomas.
Hello, Kelly. Good to see
Hello.
everybody. Happy
Good to
Microbiome
see
Day,
you.
by the way.
So good to see you, Melissa. We're going to bring you back a little bit later, so hang tight. It is just so great to have you joining us today. Now, I feel like it has been a long time coming because over the last few years, us in the patient community have noticed more and more talk about this mysterious phenomenon of bacteria living inside of us and on our skin called the microbiome, and how somehow this colony regulates many parts of our immune system and our overall health. So it can feel, I think, to some of us that it's a little overwhelming, a little confusing on how this all works. So I thought, why don't we just start from the beginning, Dr. Thomas, and strip it down. So here is my first question for you. What is a microbe first? And how is that related to the microbiome?
Sure. So Kelly, I'll explain that, and then I'd like to start with an interesting study. So micro means organisms, and it's not just bacteria; it's viruses and fungus, yeast, like the yeast infection that many women can get, especially after antibiotics. And then the word biome refers to a community of organisms living together. So it refers to all the organisms that are living in and outside of our body. And the microbiome is very important because it actually helps to get the healthy part of our microbiome is important for keeping us healthy. And just for example, if you take an antibiotic, it can kill the good microorganisms in the mouth and in the vaginal area, and then bad yeast like Candida can take over and cause a horrible yeast infection. Just one example of when bad bacteria or something bad takes over something very good. And it's we have a lot of these microorganisms, by the way, Kelly. The adult, you have about 40 trillion cells in your body, 40 trillion. But the microorganisms inside of your gut alone, you have over 100 billion bacteria just in the gut, according to the British Society of Immunology. So over 100 trillion, that's over twice as many viruses, fungi, and bacteria that you have cells yourself. You have more foreign types of organisms in your body than you do your own body itself, and that's a 1 followed by 14 zeros. And just to give you a hint of what a trillion is like or 100 trillion, if you look at 1 million seconds, that's 12 days. 1 billion seconds is 32 years, but 100 trillion seconds, like in all those organisms, is over 3 million years.
Oh my gosh.
Isn't that crazy?
I'm a little grossed out by this. So you're saying that we are more bacteria than anything else, any other cell in our body?
You got it right. Yep, absolutely. And that's just inside the gut. That's not even including what's on our skin.
Oh my goodness.
Kelly, if you don't mind, I'd like to start off with an interesting research study. Just came out not too long ago from a friend of mine, George Shokas. Dr. Shokas is the chief of rheumatology at one of the Harvard institutions, and he did a study along with some Chinese counterparts. They took 7 healthy donors, and they had those donors take a poo. Then they took 100 grams of fresh poo from each of those donors, put them into sterile plastic boxes, mixed it in with some normal saline and glycerol, centrifuged it, all in sterile conditions for 10
like
minutes.
You do. Yes.
Exactly. And they took this fecal microbiota precipitate and put it into 1 gram capsules. And just to give you an example, this is a 100 milligram capsule, so it would be 10 times more than this.
Okay.
And then they had 20 lupus patients, and all of them had really significantly active systemic lupus. They had them fast for 4 hours, and then they had to swallow 30 of those capsules. 30 of those capsules every week for 3 weeks to see if it would help their lupus, because of this very topic that we're talking about today. They could not make any changes in their hydroxychloroquine. They could not change their immunosuppressants. The only thing they were allowed to do was decrease their steroids if they got better. Well, at the end of 12 weeks, 42% of the patients met an endpoint called an SRI-4. And the importance of an SRI-4 is in anyone who reads lupus research studies for new therapies, they really need to know what this means. For example, Benlysta became prominent because it met the SRI-4 in all of its clinical trials. And SRI-4 means that a patient really has improved significantly with their lupus, but a whole lot. And they had to meet 3 things. Number one, their lupus cannot get worse by the physician's assessment. Number 2, they could not have any flare-ups, any severe flare-ups or 2 or more moderate flare-ups. And number 3, they had to have a decrease in points of disease activity by at least 4 points, and that's where the 4 comes from, something called the SLEDAI. But it's very hard to get a SLEDAI score decreased by 4, and I'll give you an example. Let's say that you have horrible polyarthritis from your lupus. You have 10 horribly swollen and tender joints, 8/10 severity pain. You're given the study drug like this one here. And then at the end of the study, you only have 3 mildly swollen joints. You feel amazing. Well, you failed that study drug because you had to get down to at least 2 or less joints. It's almost an all or nothing thing. So it's very hard to meet that. So taking these fecal microbiome capsules containing just organisms from healthy people and improve their lupus. This is an introductory study, but it deserves a follow-up larger study, and they need a placebo group, of course. It'll be interesting to see what they see.
Oh my gosh. Okay, so
how's that for a starter? Could we be treating our patients with that?
So essentially, they're eating other people's fecal matter that has healthy microbiome because, and we'll get into this, I'm sure, in a moment, people with lupus have shown in research studies to have unhealthy levels of certain bacteria that are in there, right? So we've got good gut bacteria, we've got bad gut bacteria. So if you, in this study, these lupus patients who consumed these capsules that had healthy poop, that had healthy microbiome, they saw a radical improvement in their lupus symptoms.
Exactly.
Oh, OMG is what Edwina just said, who's joining us online. Oh,
and by the way, we're already doing something like this in medicine for real. There's a bacterial infection in the intestines called C. difficile, and we can actually do fecal transplantations. Instead of going from the top, we go from the bottom to give them healthy bacteria in the same way. But these scientists thought, well, it might be a little bit easier to have patients do this than do fecal transplants.
Oh my goodness. This is so fascinating to me. Okay. So I have read, Dr. Thomas, for the most part, that our gut bacteria, they are huge helpers. They can even train our own immune system on what's good and what is bad. But can you talk about how the microbiome impacts the immune system, what a pivotal role that it plays?
Yeah, that's really important point, because people are probably thinking, why does this happen in the first place?
Right.
Number one, the intestines are the largest immune system organ of the body. We usually think of the bone marrow and the lymph nodes and the spleen, but it's actually the intestines that has 70% of the immune system of our body. And so we have the outside world, which is the bacteria and the food that we eat inside of our intestines, constantly in contact with the immune system of the inside world of our immune system, and it does have significant impacts on our immune system. Just for example, they did a study up at New York University Langone
Mhm.
Lupus Center where they showed that patients with lupus nephritis, that they had 5 times more of a particular bacteria called Ruminococcus navis than good bacteria, and the worst lupus nephritis patients had the worst cases. And then there's another one where there's a bacteria called Enterococcus gallinarum that is higher in lupus patients than in other people, and it interacts with the immune system, and then it actually goes through the intestinal wall, something that is oftentimes called leaky gut syndrome. And leaky gut syndrome basically just is a layman's term referring to the how the bacteria in the gut and food interact with the intestinal walls. But it goes actually inside of inside the bodies of people, and it translocates into the liver and the blood. And it's been shown that lupus patients have more DNA from this bacteria in their bodies than other people. And this bacteria actually interacts with the immune system and makes it more active, causing increased systemic inflammation. So that's a fascinating thing.
Yes, that is extremely fascinating. I think people, when they assume we're talking about the immune system, they think that we're talking about our blood and our cells. And to hear that 75% of our immune system is actually in our microbiome, in our skin, in our gut, that is just absolutely fascinating. It also makes me think, Dr. Thomas, of all the antibiotics that we take, and how there is there a connection between imbalances in the microbiome and what we're hearing more and more about antibiotic resistance?
Yeah, so that's an interesting question, because it also brings up another very interesting question, and that is, what came first, the chicken or the egg? And so
Right.
when you take lupus patients and you test the microbiome in their intestines, it's markedly abnormal compared to healthy individuals. And people with sicker lupus have more abnormalities in the balance of their bacteria in their gut compared to lupus patients who are under very good control. And the question is, does this abnormal bacteria in the intestines cause the lupus to occur in the first place and be bad, or could their treatment of their lupus be influencing it, or could the steroids or antibiotics that they take? And that's a big question that we really don't know the answer to, except for some of these causative studies and treatment studies that I just mentioned, like the feeding people the fecal bacteria from healthy
The poop
people
pills. The
better.
poop
Yes,
pills,
the
yeah.
poop pills. Um, exactly. So that's a big question: is the chicken versus the egg, and we need more research on all of this.
Okay, now I'm super intrigued because, um, I read about the antibiotics resistance, but to hear that there might be other medications that affect our microbiome as well, that's really fascinating. You just mentioned prednisone and how there's not really definitive research, but they're starting to look into that and how that may affect. And wow, that's
And
pretty incredible.
the antibiotic question is a lot more complicated too. You would think automatically, oh, the antibiotics are bad and they're probably could make it worse, or hurt our system, which absolutely it does when you think about something like Candida. But there's a study where they took lupus mice. There's actually mice who get lupus, and virtually all of them get lupus. So they took this one particular strain of lupus mouse, and they had them born in a germ-free environment, so no bacteria whatsoever, no germs whatsoever. And then they took this bacteria, which we know can increase inflammation in the body and increase the risk of lupus. I already mentioned it earlier, Enterococcus gallinarum. And they put this bacteria into the gut of these germ-free mice. The bacteria went through the intestinal walls, leaky gut syndrome, went through the blood into the liver, caused systemic inflammation. Those mice developed high anti-double-stranded DNA and high anti-RMP antibodies, more so than a placebo group of mice. But they took another group of the same type of mice, and And what they did instead is, in addition to putting the bacteria in the gut, they gave some of them an antibiotic to prevent and kill the bacteria, and they gave other ones a vaccine to prevent the bacteria from taking over. Those mice who got the antibiotic and the vaccine actually did much better with less disease activity. So it's a very complicated story.
Oh my goodness, that is extremely, extremely complicated. Wow, it is so fascinating. So I know we've already kind of started to go there about how all of this plays into lupus and lupus disease activity. Now, with your patients, Dr. Thomas, and I know that you've seen thousands of patients over your span of your career, how much has this subject come up, and how important is it to you to talk to your patients about the importance of understanding the microbiome connection and maybe some things that they're doing to hinder the health of their gut, and some things that are important to consider to improve the microbiome?
Sure. And so first, I'll start off by saying that there is absolutely no diet proven to help lupus or other autoimmune diseases, but there is mounting evidence that it probably is important. For example, have been papers presented at the American College of Rheumatology showing an anti-inflammatory diet can actually decrease rheumatoid arthritis, systemic inflammation. So there probably is something in all of this, and there's mounting evidence that there does. Wellness habits are incredibly important. We're finding that out more and more, not just diet, but exercise, practicing mindfulness every day with breathing exercises. All of these have been shown to help the immune system. But let's go back to the diet, and I won't talk about the anti-inflammatory diet. That's a whole hour in and of itself.
Right.
But let's talk about probiotics and prebiotics and helping the microbiome inside of the gut first. And again, none of this is proven, but I do recommend this to my patients because we know it's healthy, and it could potentially help out lupus disease activity, as we see in these mouse studies that I've been mentioning. But I'd like to mention one other mouse study before I jump into what I recommend for diet for my patients with these things. Yale, big important university. They took lupus mice again, so those mice that develop lupus, and
I love them.
and what they showed is that these mice had too much of a particular bacteria called Lactobacillus reuteri. And we know that this particular bacteria, Lactobacillus reuteri, increases inflammation and can increase disease activity in lupus mice. And they had too little of another type that's an important bacteria called Clostridiales. And then what they did is they took these mice, and they had two groups. One just ate things normally. The other group, they fed them a very high diet and something called resistant starches. So remember those words, resistant starches. These are types of starches that are poorly digested. They go into the large intestine, and then bacteria, beneficial bacteria, feed on them, and they ferment it, and they change it into something called short chain fatty acids, which have anti-inflammatory effects. And what they showed is that these mice that were fed a diet high in resistant starches for 6 months, that at the end of 6 months, they had a lot more of the beneficial Clostridiales, a lot less of the bad Lactobacillus reuteri, but more importantly, they had lower disease activity from their lupus, affecting the liver and the kidneys and the blood counts. They had lower interferon levels. That's a magic word because Safnello, a new FDA-approved drug for lupus, interferes with and decreases interferon because it's such a bad thing in lupus. So they had less interferon, which is good. And these mice lived longer. We don't have a human study that shows the same. It's much harder to do a human study, by the way, Kelly, and I don't know how we're going to do it because we can't take human beings and cage them up in cages for 6 months and force them to eat a particular diet over that time. So that's one reason why it's so hard to get a good food study in humans. But because of this research, I recommend to my patients that they eat a diet high in resistant starches, which is a type of prebiotic. Prebiotics, think of it as food for the bacteria and probiotics. You need to have both. And examples of resistant starches include green plantains, green bananas, cold oatmeal, not hot oatmeal, but cold oatmeal. And that's really important because the cooking process changes the structure of the molecule of the starches. You want to have cold oatmeal. If potatoes is another example, but not just regular potatoes, you have to cook it and then refrigerate it overnight and eat it. And whole grains is another one, but eat those as food. Other important prebiotics include whole grains, also vegetables and fruits. Fresh vegetables and fruits are very, very important. What I do is I take oatmeal and I just pour milk into it. I let it sit in the fridge a while. Some people call it overnight oats, and then just put in some blueberries and walnuts. Walnuts are very high in omega-3 fatty acids, and you got a great prebiotic food there to feed yourself. So that's one of the things I recommend. Number two, should patients take probiotic tablets? And I recommend no, and other experts also recommend no. The reason for that is we don't know how they interact with the immune system. Those probiotic capsules and tablets have a lot of different bacteria, and in the animal studies, some bacteria will make some autoimmune diseases better while making other ones worse. And just for example, I was able to find some probiotics that had this L-reuteri in it, which is bad for lupus. And so better to get it from probiotic-rich foods until we know for sure what to recommend to patients. And so you want to have probiotic foods that are high in two types of bacteria. These bacteria have been shown to be beneficial in the gut of people with autoimmune diseases. One of them is called lactobacillus, but not the reuteri type, the other lactobacillus species. And then one called Bifidobacterium. And just some examples are culture-rich yogurt, fermented sauerkraut, fermented pickles, kimchi, kombucha. You can easily do a Google search for resistant starches and probiotic foods and easily find these. So I try to every day to have some cold oatmeal and some culture-rich yogurt, and I got my prebiotic and my probiotic.
Wow. Yeah, some of those things were pretty surprising. The green plantains and the cold versus the hot difference with the oats. And a lot of times we buy things that we think are whole wheat that are not, so it's important to make sure we're looking at labels of the items that we're eating, so we get that. And the pre and probiotics, that is definitely something that is not really often explained, so I appreciate that so much, Dr. T. That is great. Sure. I know that you had sent me some information that we're going to post for everyone. There's a great study. I can pull it up right here if you want to mention it quickly. Can you see it on your end, Dr. T?
Yes, and I highly recommend this for anyone who has doesn't mind reading highly technical medical information. This is a great this is free on the internet, by the way. You don't have to buy this. Most great medical studies are very expensive, but this one's free. Just do a Google search for lupus science and medicine, gut biota and SLE, and you'll find this really nice article from last year. And before I get done with my section of the hour, by the way, I want to mention one other thing. The other important part of the microbiome that everyone needs to pay attention to is the mouth. We know now that poor dental health increases the risk of some autoimmune diseases, especially rheumatoid arthritis, but also now we're seeing more evidence of lupus. In lupus patients, one study showed that they have higher antibodies against a particular bacteria that causes bad dental health inside of the mouth. They also showed in one study that they took a bacteria, they showed that the bacteria that are bad in periodontitis interacts with the immune system in an abnormal way. And then they took patients with lupus nephritis, bad lupus nephritis, which 40% of our patients get. They all were treated with cyclophosphamide chemotherapy, but half of them, they gave them periodontal treatment. The other half, they did not. The ones who got periodontal treatment, improved their dental health, had significantly less lupus nephritis disease activity at the end of the study. So be very good. You want to make sure your mouth is moisturized. Most lupus patients don't have enough saliva. If you don't, ask your doctor for cevimeline or pilocarpine to increase it. Use xylitol candies and gums throughout the day, and get those teeth cleanings regularly, and do not smoke cigarettes.
Wow. So what you're saying is there's many things that can interact with our microbiome health, and that those of us who have systemic lupus, those of us who have Sjogren's as well, need to be especially careful of our oral health. That good to know.
In fact, one of the bacteria that they found in the bad dental health patients actually interacted with the immune system and made anti-SSA antibodies. Anti-SSA,
Oh,
the Sjogren's syndrome antibody.
wow, wow, wow. That is incredibly interesting. We have a couple of questions. If you have just a couple more minutes with us, Dr.
Sure.
T. Almanesh is here, and
Oh,
they're
good.
asking, yes, does your microbiome levels impact your susceptibility to getting staph infections?
I don't know the answer to that, but I would think so, because just because the microbiome is just so important for fighting off infections and keeping good bacteria and bad bacteria under control. I'm not an infectious disease expert, so I'm not going to pretend that I know the answer to that, but I would guess so. That'd be my guess.
Yes,
As we know, for example, it's important for keeping away Candida yeast infections, for example.
Yep. And then someone had submitted, before we went live, a question about testing your microbiome. Are there ways to test your gut microbiome to see if it is imbalanced?
There is, but only in research situations right now. It's an incredibly expensive technology. They actually label and identify all the different types of DNA that's inside of the ribosomes of bacteria, and each bacteria species has a different signature on this when they look at it under the microscope. But it's incredibly expensive, and it's not available for clinical use yet at this point.
So would you say that it's more based on your individual symptoms and gut health that can kind of come together to determine with your medical provider if you are in a healthy place or unhealthy place with your microbiome?
We just don't know. It's a big question. Outside of research, we just don't know. And I know that there are, by the way, kits out there to look at the microbiome, but I would really not trust those. I really would not spend my money on those, because I can't imagine those being really highly accurate. By the way, it's hard enough to get a high accuracy in a research setting with lots of sterility and safeguards and such.
And lastly, we've got a question on your favorite type of yogurt, Dr. T, that you like to use for your probiotic.
Okay, this is an important recommendation. I do intermittent fasting. I lost 40 pounds 5 years ago. Easiest thing in the world to do. Everyone should consider it. There was recently a study came out that showed the health benefits of intermittent fasting and losing weight, but I love it. I don't start eating until about 3 o'clock every day and stop eating around 10 o'clock. But consider that, because I could not ever stay on a diet, ever, never, ever, never. But anyways, what I like to do with my oatmeal is, and a doctor, weight loss expert of mine, a friend of mine recommended this to me. It's called Siggy's high-fat yogurt, and I thought he was crazy at first, and he said, nope, give it a try and see what you do. So I filled up my refrigerator at work, and as soon as I break my fast, I would start eating it. And it really fills you up very quickly. It's the short Siggy's, Siggis, so they're short, not the tall ones. But the high fat part of it fills you up quickly. It's high in protein, and it's high in live cultures. So that's what I recommend. Don't get the fat free, don't get the sugar free. You want to get the one that fills you up.
Okay, you heard it here, people. Get that in your Amazon cart if they even offer it that way. So Siggy's with an S, right? Siggy's high-fat yogurt.
S as in Sierra, IGGI''S. Get it on your local Instacart.
I love it. Well, thank you so much, Dr. T, for your time. We went a little bit over the 30 minutes, so I want to be respectful. So just so people can find you and connect with you in your events and other projects, and to hear more about your book release, where can people find you, Dr. Thomas?
I recommend lupusencyclopedia.com. That's a blog that I have. I post blog posts about recent research and how I like to post practical things that people with lupus can actually do to help themselves. Anybody watching this I know is interested in diet, so make sure you go there and look up my updated anti-inflammatory diet blog post, which I updated just a few months ago. It has the latest in it, except I didn't put in this study, which I'll have to add now. The poop pills.
The poop pills, yes. Everybody's going to be very excited to read more about that. Well, we have this study as well available for free that we can send to anyone who's interested. Also, I can screenshot it and put it in the comments section too. And thank you so much, Dr. T, for your time. This has been absolutely eye-opening, and we will continue to peel back the layers of this mysterious thing that we have in us that is so powerful, and hopefully something that we can be proactive in our everyday choices to improve our health and longevity with living with lupus. So thank you again, Dr. T. We look forward to the second edition here. Can't wait.
You're welcome, Kelly. And remember, knowledge is power. Keep up the good work, Kelly, and everybody keep learning, and you're going to do better with your lupus. Thank you.
Thank you so much, Dr. Thomas. Well, that was just so wonderful. Oh my gosh. I know. It's a lot. It's a lot, right? I was listening to a TED Talk earlier today where a microbiome ecologist was talking about how we are literally 3 pounds of bacteria inside of us. And I almost went, ew, first of all, but oh my gosh, it is such an important thing to realize, because then we can take care of our bodies and incorporate things into our lives that can help, hopefully symptomatically. So we've heard about the microbiome, we've heard about the clinical implications, we've heard about the imbalances of it, but now what? Well, guys, I have the privilege of introducing certified functional medicine health coach, patient advocate extraordinaire, content creator, and the executive director and creator of Support Fibro, and especially my friend who I love working with, Melissa Talwar, to talk to us about the nutritional insights into this topic. So Melissa, how are you? Thank you for waiting so patiently.
I'm excited to be here. Happy National Microbiome Day.
Happy National Microbiome Day. Are we the only ones celebrating this today? I feel like we're the party people in the corner going, let's talk about this.
I know. I feel like I needed to wear a poop emoji shirt or something like that to celebrate. And I know we don't even have the poop emojis here, but you know, you can, if you want to post in the comments, leave us a poop emoji to let us know.
Please do. Please do. I almost died when he was talking about the poop pills, but the fact is that the science is there and the research is there to show that people with healthy microbiomes have a definite upper leg than us that don't have healthy microbiomes. So I feel like I've learned so much already, Melissa, and I'm so excited to listen to some hopefully good news about how we can be proactive in our own health to hopefully improve our microbiome. So with that, I'm going to just let you take it away, and I will be streaming for viewer questions on the site. Oh, the poop emojis are coming. You asked for it.
Bring it on. And I love the fact that we're going to make fun dinner guests. That was absolutely entertaining to hear. Yes. So invite us to dinner and we can talk about gut health and poop. And it was kind of fitting because in my presentation, I'm going to talk about this more, but your poop is a clue. So I love that Dr. T was talking. I know you're like, oh man, I can't imagine swallowing those tablets, and it makes us squirmy. But this topic is very important to kind of review. And as I was doing more research too and understanding lupus and the digestive process, I'm learning from all of you as well, and how it can cause a variety of GI issues. We talked about intestinal permeability. I was taking notes on some of the stuff that Dr. T recommended. And so if you do when you go over to his website and you download all that information on anti-inflammatory diets, this is where health coaching kind of comes in to help, because all of this is important. So the human gut microbiome is definitely essential for development, immunity, and nutrition intake. And it's one of the most discussed areas, of course, is how to balance these microbes that are billions, right, through nutrition. And as Dr. T pointed out, there's not one specific thing for all of us, but there has been a lot of science investigating the relationships between nutrition, microbiome, and disease risk. But again, the thing to always remember is that we are all individuals. So we eat differently. We have different amounts of stress levels, different exposures. If you've been prone to more head injuries and concussions, this is going to factor in to microbiome health, as we're seeing more research in that area. And then even movement routines, and then of course genetics. So this is why it's tricky to devise one plan that fits us all. So just remember, it's individualized for everything we do. Okay, let me make sure I can change my slide. Here we go. Okay, so just a little bit about me. I am Melissa Talwar. So yes, as Kelly mentioned, I'm the executive director of the Support Fibromyalgia Network. I do work in group medical visits currently. So what I do in health coaching, partner up with providers and provide lifestyle and behavior change under the prescription of providers in a group setting. I work with a lot of chronic illness conditions, including lupus, chronic pain, and I do work prevalently in the neurodegenerative spaces, working with patients that are living with conditions like Parkinson's disease and Alzheimer's. So there's always this basis of behavior change, like Dr. T mentioned, nutrition, mindfulness, movement. It all plays a factor into digestion. And this is just a reminder for everyone out there to please work closely with your healthcare team and bring them aboard. So I'm going to create a lot of awareness on maybe some tracking and brainstorming. I encourage you to write it down and share with your providers. You don't have to necessarily wait to talk to a GI doctor about your bowel movements. I always include it with primary care health. It keeps them on their toes. And also, if you are working with a registered dietitian, I know that there are some wonderful ones in the lupus space that can do this meal planning with you. What would kind of goes with health coaching is the implementation. So a lot of this will talk about behavior change more than specific protocols, but I think Kelly and I can have a good conversation about it. And it was good to hear from Dr. T giving us some advice on how to troubleshoot with specific foods. Okay, let's kick it off with digestion. I want to make sure that people create awareness. So I created this visual document for everyone, because when we think of digestion, sometimes in these images, we only look at the stomach or the intestines, but there's so much more involved with digestion. And it starts even with, as he mentioned, the oral biome, the mouth, so your teeth. You're digesting your food. There's a lot of enzymes involved with just from the very beginning. So I want people to give a reference that there's a lot of organs involved that maybe they're not part of the digestive tract, but they can influence digestion, especially when we talk about gallbladder, pancreas. So these are things to create awareness around, especially if you are managing digestive issues. And the human gut microbiome is a critical component of digestion. And as was mentioned, it's a large portion of the intestines are part of the immune system. So much is involved. And I know, as Dr. T mentioned, it can affect all of the production of salivary glands, muscle tone, digestion, and absorption. So you're going to absorb a lot of these vitamins throughout the system. So if you have malabsorption, this is where some of the nutritional deficiencies come up. I know we talk about a lot with vitamin D levels. So it all factors in and how you can play a role with absorbing more nutrition through absorbing more vitamins through nutrition. Now, one thing just to touch upon when we talk about digestion, and you mentioned it too, is mindfulness. And so many times we're thinking more about, okay, what can I eat? But if you're already on a great nutrition plan, an area you might want to take a look at, because if things are still, you're having digestion issues, is maybe taking time to slow down and eat your food, sit at a table, maybe socialize if you feel better with that, but being present when you eat, being present as you chew your food. If you're the type of person that's always on the go and you're eating on the go, this can play a factor into having digestive issues. If you're sitting there on the computer, all of that can make a difference. So I just want to bring that up, that mindful eating. If you feel like you have your nutrition dialed in, but something is off, stress plays a role in digestion. In fight or flight, it does matter.
Mm-hmm. Can I say something real quick, Melissa?
Yes.
Okay, that just hit me so far, and I'm really curious if that is, if they were to study other countries, not our Western U.S., where everyone eats too much, too quickly, on the go, and obesity rates are just really, poor in our country. If they were to study the microbiome in other countries where they take hours sometimes to eat a meal, and they eat slowly, and they have smaller portions, and they eat fresher foods, I wonder if there'd be a difference, because I definitely feel like this Western go, quick, convenient, whatever you can, hustle bustle in your mouth, is impacting our gut health. So sorry, I'm just curious about that, but please continue.
Absolutely. And I think maybe if anyone's a ChatGPT person, maybe we can put that in. But I'm sure even if we just Google it, there's probably someone already talking about it, because you're right. We see this in different countries. Culturally, people have already integrated a system for improving and optimizing digestion. And we kind of see that around the world. Like you said, they take time to eat, or maybe they've already added things like kimchi or sauerkraut, digestive enzymes that kind of come in through bitters. You'll see it culturally, they incorporate bitters already into their eating habits. But here we've kind of like thrown that out the window. So it's like as fast as you can. And even in workplace environments, we always advocate for people to take a break instead of always sitting through lunch. Maybe with your coworkers, take a moment to go eat lunch together. So you're actually making an active attempt to eat food separately away from the computer. So these are all things that we can actually do together to improve our digestion. Now, I moved over to tracking your bowel movements. If anyone's heard me talk, I definitely will bring this to the dinner table in conversation all the time, even before nutrition. Some people think, oh, you're going to talk about nutrition. I was like, I'll get there. But are you tracking your bowel movements? Because bowel movements are an important part of removal and detoxification. And of course, we tend to focus more keenly on what we put into our body rather than what comes out. So I wanted to just take a moment to acknowledge we also got to focus on what comes out of our body, because the process is really intimately related. And if you're not extracting, if you're not pooping, that stuff is staying within your system, and it's affecting your microbiome. It's affecting your gut health. And you might see this with other chronic ailments, because anything that's undigested particles, it might actually just create even other health challenges. And sometimes we hear that with different diagnoses. But just remember, again, this is how we intake our nutrients. This is how we get some of the water and other things that we need for better and healthy microbiomes. So making sure you're pooping is an important piece of this. Now, you don't have to be as descriptive with this, but I just want to reference the Bristol Stool Chart because it's out there. It's a fun way to impress your doctor, to tell them you're tracking your poop or your stools, and especially helping with figuring out what's going on. Maybe if you have an additional health challenge, or you're just noticing a new medication, or you're having a lot of symptoms. It's a great way just to kind of track what's going on. And in full disclosure, I actually have a whiteboard in my bathroom because I, as a patient, have had severe digestive issues.
Yeah.
And being in this autoimmune something category where I was told I kind of have indeterminate colitis, but nothing there. And so there's no treatment for me. So I have to figure out what behavior changes I can do to help my gut system. And my gut was more debilitating in my life than even chronic pain was, given the fibromyalgia diagnosis. So I had to really track and make connections, not only with nutrition, but my stress and my sleep levels. So if I get really poor sleep, my gut is totally out of whack. So I have to keep that in mind. And I have different meals that I plan for different adjustments. And then, of course, as I mentioned with Dr. Terry Walls, if you want to simplify and track, just think of things. Are you pooping rocks, snakes, or tea? So you can see this with the Bristol Stool Chart. If you really want to get nerdy and detail-oriented, you can take the different 7 types, but you can always just simplify it. So pooping rocks, you might need some more fiber, or you might be pushing a lot, because we really want to avoid you're pushing, you're struggling on the toilet. Snakes, you just have a smooth delivery when you're on the throne, which is what we're kind of looking for. Or tea, you might be darting to the bathroom. So maybe with these nutritional changes, you got maybe too much fiber. You might have an infection going on. We see this a lot with antibiotic use. Yeah. There might be some underlying problem that you might need to be noted and working with your provider, because it's no fun if you're constantly running to the bathroom all the time and you're just noticing these. So this is a good way to kind of notice shapes. I do encourage people, if you really want to get nerdy, look at consistencies, smell. If you are a hyper wiper, notice that too. So you can dive deep into poop health.
This is amazing. I'm dying. This is so great.
I told you, I'm fun to have at a dinner table.
Wiper.
Well, there's no TMI, and I really encourage people to talk, because sometimes we forget, or we don't want to talk about it, or we're embarrassed to talk about it, and we kind of wait till we get to see the GI doctor. But this is stuff that might be coming up, and just it'll help you too with nutrition, and especially as we move over to the food, mood, and poop journal. So there's a lot of food, mood, and poop journals on the internet. So you can always download one that feels good for you. There's free, there's paid. I have a functional medicine one that I can share with you for free. Just email me.
Okay.
But what I like to do is I like to start with food, move to poop, and then kind of add in mood. And you want to do this where maybe you track it long enough where you can start to see patterns, but just start tracking it. Don't jump to any conclusions at first. Just capture the data. And if you're adverse to tracking your food, don't worry, you can skip that part. But you'll start to see patterns potentially in what you're eating, your bowel movements, maybe what you need to increase. And then by food, what we mean is if you eat a meal, like what do you notice? Do you notice more joint pain? Do you get really fatigued and have to go to sleep? Do you notice more brain fog? So this is kind of where we put it into the mood journal. And we have obvious ones, like if you get hangry, like if you've eaten a meal and then an hour later you get really hangry, that's stuff to create awareness around as well. So it all connects together, and that's what we're trying to put together for you, and brainstorming new ideas for getting creative with nutrition, because this is a big part of it. It still works, and I know everybody likes to jump to what do I need to eat? Yeah. But if you don't have that piece yet, it's okay. We'll work with it. But that's why I had to start in a different direction, because I did watch a lot of even Lupus videos on gut health. They jump straight to nutrition. Yeah. And I was like, I need people to make sure that they're tracking their poop. So feel free. And it's a great conversation piece to have with your doctors. I even have it with neurologists all the time in my groups, and they get a kick out of it because patients will come and be more open-minded to talking about their bowel movements.
Wow.
For nutrition. Okay, so again, Dr. T mentioned different things. He has an anti-inflammatory food plan. You may be working with one of the registered dietitians in the community. So what happens here? And I just want to take a moment to acknowledge, if you've ever done this stuff, how complicated it can be. And I love that Dr. T mentioned that he wasn't able to he liked intermittent fasting because all of this sticking to plans was challenging. So if you're in this boat, I want you guys to still have fun with food. Sometimes we start thinking about everything we can't eat, and I want to bring it back to the foods and really think about what you can eat, what you enjoy. So some of the ideas here is exploring more of inspiration. If you have a family, you might have fun with colors. So you might pick a color for the week that you might want to add in. So of course, we love purple at our organizations. So maybe start with purple. So what fruits and vegetables fall into purple and blue categories? And there's a lot to play with. So purple cabbage, even the outside of kohlrabi. And if you can look up these things and get curious, there's purple cauliflower, there's purple carrots. Have fun with those blues and fruits. Experiment with ideas like artichokes. Like, what is that? If you haven't tried it before, maybe add some of that in. And if you're a visual learner or like to do, you can create these inspiration boards, maybe like cut stuff out of magazines. If you get them delivered, Pinterest boards have a lot of fun with pinning recipes that you can eat, and just get inspired with it. Because a lot of this too is about preparation. And I think this is where people struggle. Like, you get the prescribed meal plan and now you're like, what do I do with this? What do I do? I'm struggling to implement. So if you are given this and you're noticing barriers, you might want to start with the preparation piece, which is usually some of these hurdles that come up for people. So brainstorm ideas of recipes first before you even dig in. What things do you like to eat? What vegetables would you like to explore? Another area to consider is, where are your cooking skills at? And I don't want anybody to feel like they're behind, because I would admit some of us aren't Chef Gordon Ramsay here. So you're going to want to think of recipes and maybe collect some recipes that fit with your cooking skills a little bit better. You might need tools to help you with that, like high-speed blenders to make more smoothies, to soups. Maybe crock pots or instant pots work better for your skill set and your time. So what does your lifestyle look like? Are you very, very busy on the go? Are you currently managing a lot more flare-ups with chronic pain? So this is why you kind of have to prepare before jumping in. And I encourage you having these conversations too with your provider and dietitian to let them actually know where you're at, because most of them will push you a little bit further than maybe where you're at. And it's okay to be like, wait, okay, I need to prepare. I need to get my pantry ready. Maybe you need to learn how to read food labels and get adjusted, or have supplies ready. All of the above. Maybe you got to take sugar out. You notice that you love those sugar treats, and if it's in your house, you're going to eat it. So this is all part of the preparation. And that's why we talk about these things with gut health, because you might need these extra tools. If you're noticing maybe you have more gut issues with raw foods, maybe having more blended, steamed, or baked vegetables will be better for you. Because some of us can't handle eating salads all day long either, because the chewing is tiring. You might have more gut issues. You notice when you poop, you have undigested food. So this all factors in with that. That's why we just want to create more awareness. And then the last thing, again, is just to summarize: brainstorm ideas. Have more ideas come to you. Have fun with it. Please don't forget to have fun. And then also crowd out that plate with colorful goodness in summary. So rich, nutrient-dense vegetables, fruits, and focus on what you can eat. Do you recommend cooking more at home? That's one of the things. Maybe learning. If you struggle like I do with cooking, it's a hard thing. Adopt these tools that make it easier, but that way you have more control over the food that you are eating. And you'll get used to it with more palates. Herbs are great to have, so you can add herbs. They have a lot of nutritional benefits to your food. And then, of course, the big topic, if you do have to start anywhere with elimination, start with slowly taking out more of the processed foods and added sugars. So that's the biggest place to obviously start when it comes to gut health, as opposed to like, what do I eat? What do I eat? What do I eat? Just start again with the basics. If you can, look at maybe some of the cultural recipes, what works for your lifestyle, where are you at with your cooking skills, pick that out and make that work for you. So I just want to say thank you so much, everyone. Thank you, Kelly, for having me aboard on this and More Than Lupus Friends. I appreciate it. Please send me an email. Again, I can get you the Food, Mood, and Poop Journal. And I'm always happy to talk about bowel movements if anyone else wants to chat.
You are a poop powerhouse. Yes, if anyone ever wants to talk about poop, she is here and ready for that conversation. And It's been amazing how many people have said, wow, this is so informative. This is enlightening. Uh, um, this is so interesting. I mean, guys, poop is a part of our lives every day, and we don't talk about it. And it has such a window into our health. Why are we ignoring it? I love the Bristol stool chart. I'm going to go back and screenshot it. Actually, could you send it to me and I can post it in the comments too? That is so fascinating. Also, the poop, mood, and no, what was it?
The food, mood, and poop
food,
journal.
Mood, and poop. Yes, that is so good because that shows measurable improvement or decline if you're not eating a particular way that you know you should be eating, and you can see it. It's right there. You can see it. That's the data.
Well, and we really forget being like kids, right? If your parents out there, like how frequently are you checking the baby's diapers? Like they poop, right? We all
the time. And then at some point you just stop. Oh, I mean, there's a whole thing with the baby's newborn poop that you see it change every month, and you're tracking it to make sure everything is okay with their GI system and the foods that they're eating. And then we just stop. And then we start eating processed food and sugar and throw in the towel here. So this has been so fascinating. A lot of people are asking if they can chat with you. And if you are comfortable with putting your email in the chat or giving some sort of contact place that they can find you and the work that you're doing.
Oh, absolutely. And I know we've talked about doing more workshops to talk about this, or even group coaching through the nonprofit. So it's a scholarship based. There's a lot we want to do. So I'm more than happy to chat. And we always collaborate with Kelly too. So whatever, we can just do even a poop journaling class.
Yes. We can go around and share, and then we can bring Dr. Thomas back in and he can tell us more about the poop pills, and we'll all have a really great time.
It'll be a fun potluck. That's why I said we'll make great like lunch or dinner guests. But I mean, he was really, I'm going to have to take a look at his anti-inflammatory program because I'm sure so many people have questions. I was diligently taking a lot of notes too, because we're so different in what we can handle eating.
Right. Yes. And not to mention how he said earlier too, our medications that we take for our symptom management can impact our microbiome and our gut health. It didn't even occur to me. I get thrush all the time, so that overgrowth of yeast in my mouth. And I've been told it's because I've been on steroids for, I don't know, since the dinosaurs walked the earth. So it is a problem that I have, but didn't even think about that connection with my gut health. And how many of us too have these overlap conditions that affect our esophagus. Sjogren's, that dry mouth, that affects our esophagus. And many of us have that yeast buildup, and we also have sores and different things in our mouth from that dryness and the bacteria overgrowth. So really, really fascinating. So if you guys want to find Melissa, she can be found at supportfibro.org, correct?
Correct. And it's Melissa at supportfibro.org, but you can find me on social media. So look for the purple everywhere.
I'm just going to write that.
Okay. Yeah, I can't post the comments through the...
.org. That's okay. I got your back. It's right there, guys. You can send her a message. You can pick her brain. She's so wonderful. And you can always find her here too on More Than Lupus. And anything else coming up for you that you want to announce or let people know? By the way, congratulations on your nominations for what used to be WeGo Health, but it's now the Health Social Network? No.
Or Social Health Network.
Social Health Network. Congratulations. That's such a big deal. Oh my gosh.
Well, thank you. I mean, I recently too got an award for health coaching, which was huge.
Yay!
And talk about imposter syndrome. I was on the stage with the doctors that wrote, I was on the same stage with people that wrote my textbooks and that were trailblazers for health coaching. So I'm like, what? But we're making a difference for all of us in the chronic illness communities. So, I mean, shout out to all the work you're doing. I am making my way to Portland. I will send you the dates so we can finally meet. I have to stay in Portland until I meet you in person.
Yes, that's not going to be. I will not allow you to leave. I will make sure that we meet officially, because we've done so many collaborations and different things, and we haven't met in person. So this has to happen. And just want to say once again, thank you so much for your time and for sharing your insights on this. I cannot wait to start my poop journal. That is not a sentence I thought I was going to say today, but I'm owning it and I am here for it. And happy National Microbiome Day.
Yes. Let's celebrate the microbiome. And I'm excited. Again, it was hard to put together a presentation because I love gut health so much. So I went with what I know is tracking your poop.
It's so great. It's so great. So for everyone who knows someone who wants to watch this but does not have Facebook or Twitter, this is going to be downloaded today to YouTube and then posted on our Facebook and social media channels. And I will send that to you as well, Melissa, for you to share with all of your different platforms. So thank you, everyone that's been watching. We've had a great crowd today. And feel free to continue to share this so that people can get connected to support and this incredible information that was shared today. Once again, thank you to Dr. Thomas, who wrote the Lupus Encyclopedia. If you haven't done so already, check out his website, lupusencyclopedia.com. He shares all my stuff. I share all of his stuff. And we only work with those here that we truly feel have the patient's best at heart and that are filling the needs and the gaps in the patient community, which is why we have you here, Melissa. We love working with you and hope to work with you more in the future. And that's it, guys. We went 5 minutes over, but hey, too much good stuff here. Too much good stuff here. Thank you, guys. Take care, and we'll see you next time on More Than Lupus.